那我们非常欢迎安院士来为我们演讲。
Good afternoon. Again, thank you very much for your kind invitation for the lecture here, and also like to use the opportunity to thank few of these academicians for your support of our acceptance to this honorary society. Otherwise, we will not be here this afternoon. Again, you look opportunity to thank you. So this afternoon, I'd like to using this opportunity. Many I don't know who will be the audience for today's lecture. So since the center is called Applied Science Center, that's what my idea is try to use in this brief lecture to encourage student, postdoctor. So how can you help the science or technology or even the society as much as you can? Just simply be creative. So we discuss about science first or technology first, or technology first or science first. On the other hand, if you have application, you develop the science, or if you have science, you find the application, as the president mentioned this morning. So hopefully this will give you an example of what we discussed and help with all the young people for some stimulation. Because as I understand, probably different people has different background with a different topic will be not be so interesting to you. So today I specifically pick up the topic I called, excuse me, let me go back. Specifically called our versatile hand, because this is my first research topic when I get into orthopedics biomechanics. And many of the applications basically come from the fundamental engineering, specifically mechanical engineering principle. So in most of my application, I had the mind first. Then we find the potential science or technology to help the demand in the hospital. So with this in mind, I will pick up 3 very simple topics. Probably you know the physics is not that hard, but potentially give you the idea how can we adopt the physics to help the demand specifically in the medical field. How can you help the surgeons, physicians treating their patient based on this concept? So with this in mind, I will just start with my lecture. Of course, we are talking about hand. This is a hand of my granddaughter. As you can see, we can use our hand for our daily living. We can use our hand to express our emotion, or so on and so forth. Finally, of course, we have artists. They can use their hand to not only painting, drawing, they can play instrument as well. So the hand is very versatile. It's very useful. Even just for nowadays, I didn't have the picture with hand with iPhone. Of course, I didn't give them to have iPhone. Otherwise, you can see without your hand, you cannot play with your iPhone. If you cannot play with your iPhone, you even don't know how to pass your day for each day. So hand is very important. And briefly, hand, we have basically 27 bones in the hand with 27 joints. Again, as you can see, there's a lot of, excuse me, I always get back. There's a lot of bone in the wrist. Basically, there are 8 bones here. There's a unique structure for that. Because of this design, so we'll be able to conform our hand to any shape of the object you try to handle. Of course, we have muscles as well. We have 34 muscles. Many of them are intrinsic muscles. I'll keep pushing it wrong one. Most of them are intrinsic muscle, which is the muscle in the hand. And we have muscle in your forearm, which come to the hand through tendon. Basically, after my understanding of anatomy, after my research in the biomechanics of hand, I found out, indeed, the hand are created very dedicated and precisely for all the purpose. So, of course, we don't take for granted we have very capable hand. As soon as you have any injury, which could be part of your joint, could be even just a fracture of your hand. Fortunately, in Taiwan, you don't have ice. You don't get much injury. But in the northern Minnesota, if you fell on ice, either you fracture your hip or you fracture your forearm. So that's what, then you appreciate how important the hand. And quite often we have a lot of soft tissue injury. You heard about carpal tunnel syndrome, trigger finger, deaf cuvine, so on and so forth. These are all the issues associated with hand. So as soon as you have any disorder with your hand, you can appreciate the importance of your hand. So this is what I'm going to give it to you briefly with the 3 examples. Before that, I want to just briefly introduce myself as for the young people, give you some idea how can you develop your career path. And basically, I was trained, as mentioned by your chairman, was at the National Cheng Kung University in mechanical engineering from 1965 to 1969. Specifically, I'd like to give appreciation to these 2 professors. One of Professor Ma, he graduated from National Central University in China, and Professor Xu, he graduated from Tsinghua University in China. Both of them are the older generation professors. They really spend a lot of time with their students. They're not only just using the textbook. They don't use in the textbook when they're teaching. They just comes in with a chalk on the blackboard. Everything going out from the basic principle. So those developed my interest in, especially Professor Xu was in mechanical engineering. So that's what made me very interested in applied mechanics. So when I finished my training and finished my military service, I was very fortunate to receive a scholarship. In fact, from 3 universities. We include Brown University and University of Rochester in New York and Lehigh University. The reason I went to Lehigh because, fortunately, I have scholarship. One of the leaders, that's what I was looking for, is Professor Ron Rivlin. He was at Brown University first, but by the time I applied for my scholarship, he moved to Lehigh. He was recruited there. Then, fortunately, my classmate they told me, if you are still interested in applied mechanics, Professor Ron Rivlin moved to Lehigh. I said, I'm very thankful. I have the scholarship for Lehigh as well. So I went up to Lehigh. So I spent 2 years to study under his group at Applied of Mathematics to study the tsunami, the wave formation. What are the impact force of the tsunami when they hit the solid on the coast? But after I finished my master degree, then this professor, Eric Salate, approached me. He was a young professor. He said, are you interested in fluid mechanics in biomechanics application? I said, what is biomechanics? He said, I don't know either. He was a young engineer and he's a mechanical engineer background, applied mechanics. So 2 of us went to the library because he heard about biomechanics. So we went to the library. We dig out the Journal of Biomechanics. This was 1972. Journal of Biomechanics started from 1969. At that time, we dig through the Journal of Biomechanics. A lot of papers were associated with biofluid mechanics, especially associated with the circulation. You know Professor Y.C. Feng, Professor Xu Qian, those are the pioneers. They, especially Professor Y.C. Feng, he was in the aerospace engineering. Then he started with biomechanics, but more or less concentrated on circulation. How does the blood pumping through the artery, capillary, eventually venous, back to heart, especially pushing the red blood cell. How do we push them? Such large, big red blood cell, they have to deform, squeeze through the capillary, can be captured on the other side. So that's why the Professor Eric Salate and we went to the library. He said if we pick up a topic in that area, we are probably 5-6 years behind Professor Y.C. Feng and Xu Qian's study. He said probably we should think about other topic. Even he was an engineer, he didn't know much about physiologists. He asked the question. He said the nutrient, the water must come out from the vessel in order to provide the nutrient to the body. Then eventually the waste has to be picked up by the vessel as well. So 2 of us went to the physiology department. we check with the chairman. We say, is such a thing? He said, yes, this is called filtration. He said, if you are interested in this topic, we have a Professor Eugene Landis. In fact, he was just retired from Harvard University. And he joined us as emeritus professor. He has his lifetime study of microcirculation and filtration. So we went talk to him. He was very happy. He said, oh, if you are interested in this topic, you can do the modeling. I can give you my lifetime experimental data for your validation. Then, make long story short, we two decided to pick that particular topic. I didn't realize, again, later I found out Eugene Landis, he was quite famous. Even the American Society in Physiology, they have a Eugene Landis Award to recognize him. So I was very honored to study with him. So at that time, of course, in our center, everything has to be closed form. If you cannot develop your solution in the closed form, your study is not complete. That's what I was very stressful because that was just the beginning of final element. So I learned something like that. I say it's very powerful. I try to convince my professor, I can use this for calculation. But they say without closed form, you cannot graduate. So basically, again, make long story short, so we finished. So this is how my education started from Cheung Kong University and went to Lehigh University, finished my master degree, then PhD degree, somehow is associated with biomechanics, but not really the application of biomechanics, just still mathematical modeling, but the fourth application of microcirculation and filtration. But eventually, I will come back a little bit later, how did I end up with the job at Mayo Clinic. Eventually, I worked at Mayo Clinic. For those of you not in the field, probably you don't know Mayo Clinic, but Mayo Clinic is relatively well known in the medical field. In fact, it is ranked #1, not only in America, but globally as well. So when I went to there for interview, I will show you a couple more slides later. I didn't realize the opportunity, so I was not very serious. I didn't even discuss with my advisor. So I went there for interview, then come back and mentioned to my advisor. He said, how come you didn't tell me? If so, I will prepare you better. You can get the job. I said, people mentioned Mayo Clinic. I saw clinic. I looked up the dictionary. I didn't know what's clinic. I said, 诊所. Okay, 诊所. So that's what, after I went to Mayo Clinic, I found out it's quite a unique place. So again, I'm very thankful I have the opportunity to work over there. I will come back that later. So Mayo Clinic was founded in late 80s by two brothers, in fact, by their father first. But these two brothers, they're called Mayo brothers, joined the father, eventually make the clinic practice become very blossom because they have two basic principles. Most important one is their value. The value for Mayo Clinic is the patient is the only, the interest of the patient is our interest. That is always the traditional value for them, even for nowadays. So when you have to make decision, even at a higher level for policy making or day-to-day decision making for physicians, if you encounter some difficult part, you using that value as your guide. If this is good for the patient, I will go ahead do it, even I have to stay in the hospital overnight or whatever. So that's how they have this particular attitude and as their value. So that's what within the hospital, they are very collaborative. So talking about research at Mayo Clinic, of course, we are not as big as Academy of Sinica here, or the University of UCLA has a big resources, a lot of, this is a private hospital. We are very limited. So we do have fundamental research, basic research, but most of the research at Mayo Clinic probably was from bed to bench first. We have some needs in the patient side. Then we come to the research side. We want to find out if there's any solution for the treatment or for diagnosis. On the other hand, we have development on the bench side, and they find the application. For example, the cortisone was discovered by Edward Kendall. He was a basic biochemist. Then Dr. Hinch, he was a rheumatologist. He always tried to find a drug to treat rheumatoid patient. So when Dr. Kendall found isolate cortisone, and he tried it out on one of the patient, found out very effective, and from there on they make this cortisone recipe, synthesize that procedure complete. Then the Mayo Clinic gave that protocol to Bristol Mayo, so they can mass produce. So this was the attitude back that day. Mayo Clinic, they do not patent anything. If they have something, they give it to whoever like to mass produce. You can benefit the patient. Even I still remember when I first joined the Mayo Clinic, we cannot patent anything until probably halfway of my career. They allow us to patent. Then now they encourage people to patent. In fact, most recently in the probably 3-4 cases, they had a patent successfully developed into a drug. For example, for colon cancer screening, Colon Guard was developed at Mayo. It's $1 billion business now. So otherwise, in the beginning, they want the patient benefit. Quite often, if you patent something, you will not be able to move forward because of a patent-associated issues. But anyway, long story short, so basically they were recognized with Nobel Prize in 1950s. Give you another example. This is an aerospace medicine was developed at Mayo Clinic. So they had at that time, around World War II, right just between World War I and World War II, the jet plane developed. In order to get higher altitude, you have to have this aerospace chute. And on the other hand, they developed this G suit at Mayo Clinic. So they built these centrifuges. You can sit in there, then they can rotate, spin, and generate 1G, 2G. Then if you pass out, then they collect all the physiologic data. Based on that, they developed the G suit at Mayo Clinic. In fact, Dr. Wood was the one as a PI for this project. After he finished this development, he was the first guinea pig sit in this machine, spinning. He said, if someone passed away, even dead, he should be the first one. So again, they have that type of attitude. So in fact, during the war, one of the jet was shot down in Germany. So they found out this suit. I was told, they said, we probably convinced they cannot win the war because they have, America has a better G suit. That means they can manipulate and more and get higher altitude. So these are just a little bit background. Right now, Mayo Clinic has 3 branches. Otherwise, initially was just located in Rochester. This is what I spent 50 years there. Then later on, they branched out in Florida and one in Arizona. And globally, they have probably 6 branches in UK, England, London. They have 1 branches. In Dubai, they have 1. Even in China, I think they have 1 in Suzhou somewhere with Sao Yifu Yuan associated with that. Okay, so make the story back to myself now. How did I end up at the Mayo Clinic? The whole story started with this. This is Dr. Mark B. Coventry. He was the chairman of orthopedic surgery. One day he has a patient come from Chicago. He was probably the owner of one of the baseball or football team, I forgot. Need a treatment for the hip problem. So the patient was in the hospital, get ready for surgery on Monday. On the weekend, the patient was told, read the newspaper, found out in England, there's a surgeon called Charles, Dr. Charles, put the total hip in that particular patient. Then Monday morning, he asked Dr. Coventry, do you do total joint replacement? Dr. Coventry said, no, I never heard about that. He said that in England, someone doing that now. So immediately the patient checked out from the hospital, went to England for joint replacement instead of have other conservative treatment at Mayo Clinic. So Dr. Coventry was very curious about that. So he himself went to England, found out what's going on, and found out indeed that is a very good idea. Immediately he said, joint replacement will be the future for the next 10, if not 50 years for orthopedics business. We have to develop that in America as well. So he had that in mind. He said, in fact, he tried to import the one from England and approved by FDA so he'd be able to put in the patient. But he said we have to develop our own instead of just using other people's device. So in order to do that, so he said we have to have our own research laboratory. So with that in mind, he, again, through long story short, in 1973, Edmund Chow, probably some of you, he lives in Los Angeles, in Irvine now. He graduated from National Taiwan University in Nonggongxi. He was at the University of Iowa, just finished the study in kind of biomechanics. So he was recruited to Mayo Clinic to establish the biomechanics lab for the sake of development of joint replacement. So basically, he did not give up his position in Iowa because he was not sure if this is a serious business at Mayo Clinic. If he gave up that job, after 6 months, they found out there's no job here, then he will be limbo. So that's why he commuted for first 6 months, very challenging. But eventually he found out they are very serious. So the surgeons, after they finish their practice, they come to the laboratory. Dr. Edmund Chow taught them mechanics. They taught him anatomy. So this is how they get started. Of course, he was very lonely at that time. He has only a few technicians and one engineer work with him. These are all surgeons. So that's what he was looking for. He said, in the laboratory, we need to have more surgeons and more engineers. So this is how the story came up. So what happened was, when I was at Lehigh, one of the professors at the Chinese picnic, he asked me, oh, Mr. An, how is your study coming along? I said, oh yeah, I'm almost finished. I will finish probably thesis this summer and hopefully graduate next year. He said, have you applied for a job yet? I said, I'm not quite. As soon as I finish my thesis, I will do that. He said, before you apply your job, you get any position. Oh, he asked me, what do you study? I described to him about the circulation. He said, that is a biomechanics. I said, yeah. I said, you knew biomechanics? He said, oh, we all heard about biomechanics. He said, if before you take any job offers, I want you to go visit my cousin. Edmund Chow was his cousin. He was also a graduate from National Taiwan University in civil engineer. So immediately, that's how he connected with Dr. Chow. Dr. Chow gave me the opportunity. That's how I went there for interview. Again, make a long story short, because when I went there for interview, beside Dr. Chow, he tried to recruit me. He also found out my thesis, so he invited a few of the physiologists come to my interview lecture. And they sit in the front. I didn't recognize them. At the end of my lecture, I saw this Professor Basinwade, this is Professor so-and-so. Those are the professors. I cite their paper for my thesis. I said, wow, you are sitting here. So they didn't challenge me and give me a hard time. So eventually they say, if you come here, you work 50% with Dr. Chow. We will pay you 50% because they are doing a lot of experimental work. I was doing modeling. They say, you can help me to analyze the data. So make long story short, Dr. Chow gave me the position. So that's what I checked with my professor. He said it's worthwhile to go Mayo Clinic, give it a try, see if you like the job or not. So the whole story started from that time. In 1995, I joined this laboratory. So my first assignment is to develop the total joint replacement for upper extremities, because Dr. Chow has been assigned to do the joint replacement for hip, knee, and ankle. So that's what they say you have to start from hand, move up. So basically, these are all the rheumatoid problem. If you have rheumatoid inflammation, you can have a joint deformed. joint the damage, you need to replace. Otherwise, you cannot function. This is not too bad. Some of the deformity will be very bad, that you can see the whole finger almost turn 90 degrees horizontally. So that's what I asked them. I said, do you know how much force passing through this finger joint? 1 kilogram, 10 kilogram, 100 kilogram? They said, we don't know. I said, if you don't know, it's very difficult for me to design something. Either too big, I cannot put in, or too small. They will not sustain. So that's why we have to immediately start from scratch, doing the basic research. But this is a slide. After 15 years, finally we have some of the product. So from that slide to this slide is not overnight. It's quite a while. But I eventually will come to this. So make a long story short, orthopedics biomechanics lab, based on my observation. Of course, we start with very simple joint mechanics. Eventually, we move on to tissue mechanics. Of course, with all the technique we developed, people can apply this to study the motor control. Because you have a structure without control, you cannot move your hand. So those are equally important. Then ultimately, we have to keep moving because many of the pathology will develop not because of direct injury or simply because of adaptation. If you have a consistent use of your hand, you may get carpal tunnel syndrome. You may get a trigger finger. You may get a deformity of your bone. So if you understand the mechanical biology, hopefully you can prevent the things happen. Or even better, you may have a medication or drug for the treatment. So biomechanics is just a basic tool in my mind. With this tool, can help you to move along into different paths for the demand from the hospital or from the doctor for patient treatment point of view. So since we don't have much time, basically we just use this 3 examples. First one is very simple. How do we do force analysis? We do force analysis every day in the mechanical engineering training. But for apply that to the human body, that's a different story, because you have to collect a lot of data in order to do that calculation. So the principle is very simple, but the approach, in order to accomplish that, you demand some of the steps. Then I give you another example of motion. Finally, a brief talk about the tribology here. So in order to talk about force, first I asked the question about the force. Then I say, in order to calculate the internal force, we have to know how much the external force. Again, of course, they have a rough idea. Oh, we can do grasp of 30 kilogram. We can do pinch about 7 kilogram. But I say, do that force, even you grasp a cylinder, do they distribute equally? They say, we don't know. Then I have to design all the instrument so I be able to measure all possible force inputted onto your hand. So this is step number 1 to get that type of information. Of course, we have all the data collected, then that's the first step. After you have external force applied to the object, you have to do the free body analysis. Of course, for those of you in electrical engineering, probably you don't know that in college, but you learn that in high school. So it's no big deal. It's just high school or first year college physics. However, the free body analysis is not that difficult. You have a force equilibrium, you have a moment equilibrium. But the challenging part is each of the coefficient based on the line of action of the tendon, based on the joint contact force. These are the information you have to collect anatomically. Of course, you say, yeah, we can collect this easily based on the geometry. If I know this is a coordinate, this is a line of action, I should know all the coefficient. The problem is that you don't know how the cable, the tendon passing through the joint. It's not like an engineering design. It's very nice, clean. If I have a hinge, I have a door, I know the distance, that is your moment arm. But the tendon passing through the joint with different type of pulley constraint, with insertion through capsules, so on and so forth, you don't know. On top of that, you cannot know the precise center of rotation of the joint. Without that, you cannot calculate that geometrically. So with this in mind, then I ask myself, I said, how can I do this? Then of course we know in mechanics, if you have a cable wrapped around a pulley. Then you move this cable around, the moment arm is the diameter of that pulley. So I say if that principle can be applied for any geometry, then the measurement will be very simple. Indeed, that is true. So I'll be able to design a setup. I can collect the relationship of the tendon excursion. When I move the tendon, then I can see the joint moves. If I can get the information, simultaneously record, if this is a joint angle, this is excursion of the tendon or the muscle, then the slope is the moment arm. So this is very simple principle. Then eventually, indeed, I can calculate the moment arm for all the intrinsic muscles and extensors. So this is the first time we precisely define the mechanical advantage of the tendon and the muscle around the joint without knowing the joint center of rotation, without knowing the anatomical constraint of the tendon. So with this in mind, of course, this can help us to finish our moment equilibrium equation, so on and so forth. And also, this equation has been eventually adopted by surgeons when they're doing tendon treatment. Sometimes you have denervated muscle, you need to transfer the muscle from A to muscle B to substitute or compensate the movement. What is the best option of the selection? The moment arm is one of the important considerations. In surgery, they can roughly move the tendon and see how much the joint moves. Then they have some idea that is too much, not enough, or then they can decide which tendon for transfer. Very simple equation, but eventually not only for laboratory research, but for the clinical practice in surgery, they can use that. This is what I said, because Professor Landsmeer, he developed all this model. But I validate either this model, this model, this model. The relationship between tendon excursion and joint movement, they are all the same. So that is exactly correct. So with this in mind, then we can study a lot of other injury. For example, if you cut your pulley, your tendon will be both strained. So is this good? Of course, looks like the moment arm increase, you see, moment arm increase. From mechanical point of view, it is good. But however, we have to keep in mind, we are in a biologic system. Moment arm is associated with excursion. Not all the muscle can provide that amount of excursion. If you don't have enough muscle contraction, you cannot accomplish that amount of excursion. You cannot accomplish your movement. So let me just show you. And this has other application talking about the two joint motion. So if you move your hand like this, don't think about that. You will eventually come to this posture. This is because you have a long flexor tendon passing multiple joints. The tendon length is fixed. In order to compensate for that joint motion, in order to compensate for the wrist motion, some of the finger joint has to readjust. With this in mind, this helps us to develop the technique for rehabilitation. Later on, we can show you. If you have tendon laceration, why I say tendon laceration means you cut your tendon. For example, you buy a bagel. You try to cut the bagel into half. Sometimes you overcut. The knife cuts through your finger, then eventually cut your tendon. Then you have to come to the clinic. Hand surgeon has to suture it up. They suture it up, you have to do rehabilitation. Otherwise, the healing of the lacerated site will be accomplished within a couple of weeks. However, those tendon will be adhered to surrounding tissue. Then you cannot move. So the best approach of rehabilitation is based on this principle. So this type is very simple idea, but eventually adopt for hand surgeon to do rehabilitation. You can see some of these small things eventually can be directly translated. This I just want to use one slide to show you. So this is a muscle we dissect out. The fiber length, the muscle volume, the cross-section area, all has mechanical importance. So you can see this, eventually we have to dissect all the muscles of the body, provide us all the necessary information. So again, we don't have time to go into detail. Eventually we come back to this equilibrium equations. So the one I showed you earlier. So for each joint, we have six equations. For 3 joints, we have 18 equations. However, we have too many unknown, not enough constraint. So for those of you probably in mathematics, you know that is overdetermined problem. In order to get a unique solution, then we have to find a way to solve that. So mathematically, we have to rely on optimization approach to do this. So again, it's no big deal. It's just a very conventional mathematical approach. But you have to apply this to these applications. Let me just move on. So after all this, after 1 year, finally we come up with some number. I can tell for each of the flexor tendons, their force is about two times as the amount of pinch force. For example, if you have a 7 kilogram pinch force, you expect 14 kilogram of the tendon force passing through the joint. With this in mind, we should be able to calculate the reaction force at the joint. So like 4 times, 5 times, 5 times 7. So I know for when you're doing pinch, maybe 35 kilogram force passing through the joint. With all this in mind, eventually I can come up with the design of the joint. So again, of course, there's still a lot of gaps between that force, but I don't have time. But I simply just want to show you that simple equation helped us a lot. Not only get the data we want, but also translate it into rehabilitation, translate it into the application for surgery when they have to make decision which muscle to consider, so on and so forth. So of course, to make an implant, you have to, in fact, that time, not too many companies doing the implant test. We have to start from scratch, design all the implant endurance test, wear test in the laboratory as well. So this just showing you the application. Of course, with all the model in hand, we can use in the model for a lot of ergonomics approaches. This is just one example showing the design of the pipette. So we can use in this approach to do that. Of course, eventually we try to do the internal force calculation. So this is not finite element analysis. This is what we call the rigid body spring model. So basically, it's a simplified than the finite element because our interest is not in the bone. Our interest is in the joint contact stress distribution. So we assume bone is rigid, the cartilage is spring, the ligament is spring, so the calculation time will be very efficient. Because that time we don't have a supercomputer, so this will be important. Then we can calculate the stress distribution. Based on that, we can do some calculation of the normal situation. And one of the application is for this is called the Kinematics disease, which is absorption of this bone in your wrist. So people believe because too much stress coming down from the hand, because of the bony arrangement, this bone, this ulna stuck out too much, put too much stress on that. So based on that, we did some simulation. Which procedure will be the best to reduce the stress? Then eventually I recommended some of this procedure to the surgeons. They did try it out. Eventually they have to do clinical trial and find out what is the best way for treatment. So we run out of time. Let me just quickly move into motion. Of course, this is a famous slide. Of course, the finger joint, the ratio, in fact, follow the Fibonacci theory. In other words, this number plus this number is equal to this number. This number plus this number is equal to this number. So that's why the finger, if you look at the fingertip movement, they follow the golden ratio. You can see all the spiral shape. So that's what people always get excited. Wow, the human hand design is also follow the golden ratio, the Fibonacci theory. Of course, this is good academic exercise, but we are very interested in the practical application. Of course, we're using the camera to monitor the motion, so we have to capture the motion. So this is one of the motion we designed to consider, which is good for rehabilitation of carpal tunnel as well as trigger fingers. So we don't have time to go through. Let me just show you. Then eventually, also talk about technology. This is a technology developed by McDonnell Douglas. At that time, basically for the sake of monitoring the head movement in relationship to the cockpit. So the idea is that when the pilot moves their head, the missile or the gun can move along with that. If they look at the the airplane, they can shoot that. Unfortunately, they developed the technique. They cannot apply because the cockpit has too much metal. This is based on the principle of a magnet. So you have a source which generates magnetic field. You have a sensor absorb the magnetic field. So based on that orientation and distance, we can measure precisely the angle as well as distance. So they approached me. They say, if you have any other application, so I introduced this concept to biomechanics, so we'd be able to do a motion analysis based on that. Again, we don't have time to go into that, but I quickly just through. And we applied the technique eventually for Professor Maskey. She was an anthropologist. She tried to understand the difference between human, because her approach is from evolution. He said human are from the apes and so on and so forth. However, the human hand is much versatile compared with animal. That's why the human can hold the object like this. That's why we can have the stone tool developed. That's why our civilization can be much advanced compared with the apes and the monkeys. So this is, for that's interesting because we have all the tools in the laboratory. So they come to study and find out it's very interesting. And also, we don't have time. I will explain to you all the anatomy, which is different between human and animals. So, of course, the motion, three-dimensional motion, is a sequence dependent. We have to design the goniometer to do all the measurement, so on and so forth. Of course, we're using the stereophotographic method to go through that. Okay, with that in mind, we have, let me see, I played this, maybe not, anyway, that was a movie. So I just want to show the progress of technology. Start with a stereophotographic method, stereoradiographic method. Eventually, we have a 4D CT. We can see the image in time. So basically, that is the motion of the wrist. So the purpose of that, basically, we try to identify the index to identify. Sometimes you have soft tissue injury. It's difficult without looking at patient with an arthroscope. So if you have arthroscope, you can see which ligament has been damaged. Sometimes they come to the surgeon, they say, oh, no problem, based on x-ray, you should be okay. But 3 weeks later, they come back, oh, doctor, it's still very painful. Then they found out they missed the diagnosis. We try to develop some tools so we'll be able to help with that. So that's how we based on the imaging. And right now, this imaging has been analyzed based on AI. Again, which is very powerful, so which can help out with surgeon, give it classify what kind of injury taking places. Finally, I just show you another example. The one I try to show you is, you see, you have long tendon passing through the joint. These are all the tendon coming from the muscle in your forearm, strong flexor muscles. So they passing through the tendon, as you can see, they rub against the pulleys, rubber against the bony structure. That's why a lot of friction taking place. Eventually, soft tissue inflammation may be caused because of this aberration taking place. So with this in mind, again, a very simple principle. This is also in Mechanics 101. If you have cable wrapped around a pulley, the friction force can be calculated based on this diagram, and the equation is basically like this. The friction force is F2 minus F1. F2 and F1 are related by the friction coefficient mu as well as the angle of attack. So if there is no friction coefficient is 0, that means F2 is equal to F1. There's no friction. On the other hand, if there's no angle, there's a e to the 0 is 1, so there's no friction. So this is a very simple equation, but it's a very powerful equation for many clinical applications. First application, of course, is in the laboratory. We design a set of instruments, so we'll be able to really measure what is the friction of the tendon wrapped around the pulley. So with this in mind, so we designed this. So this is the first time we identified the friction coefficient in the tendon, which is not as good as in the cartilage of the joint. It's about 1/3 of that the joint. But this is the first time. Let me see. So this has an application in clinical application. Of course, at that time, we have a lot of design of the keyboard pad. try to prevent carpal tunnel, because if you're using, then the basic fundamental point I try to point out to the people of design, I say try to neutralize the wrist joint, because if you decrease this angle, you will decrease the friction exponentially. But if you increase the angle, if you have 90 degrees, immediately you will have a big friction. So with this simple-minded equation, I explain to them, then they know why this is important to have that. Of course, we also spend time to look at what are the specific lubricant, include lubricant and phospholipid, and also other proteins like hyaluronic acid, so on and so forth. How do they really affect the friction through the tendon? And we also develop a special CD-coated hyaluronic acid or lubricant on the joint surface to help prevent the adhesion after the tendon surgery. This eventually, as you can see, if you do not treat the tendon, so the friction will be this high. If you treat tendon like this way, in fact, you can see this is one very nice. Without treatment, you see a lot of scar tissue form. So it's a simple film attached, so the tendon repair could be much better successful. So this is another one. Probably I don't have time to go into this. This is a different mechanism of lubricant, the lubrication tribology in the wrist area. So, but instead I show you another example. So this will be my last example. This is an application. You can see they put a needle into the carpal tunnel. When you have a carpal tunnel surgery, either they're using the neurological diagnosis, make sure your nerve conduction velocity has been changed. The other way is to go in to measure the pressure within the carpal tunnel. So in fact, some of the surgeons, they really want to see the pressure. After the carpal tunnel release, they want to see the pressure drops. So then they know they accomplished their surgical goal. So of course, it is very painful. So with this in mind, one of my colleagues in radiologist was doing first with MRI, magnetic resonance elastogram. And later on, people doing this in the ultrasound using shear wave elastogram. The principle is very simple. Basically, you have a wave. You send a wave. The wave could be generated by the ultrasound probe, or you can use a mechanical wave generator. So with the ultrasound, you can capture the wave propagation based on the phase gradient. If you know the wave propagation velocity, then you plug into this equation. Mu1 and mu2 are the elastic modulus and the loss modulus. So from that, you can get material property. So this is a principle they're using for either MRE or ultrasound shear wave elastogram. MRE was developed by my colleague at the Mayo Clinic. So when he developed that, I said, when you successfully develop that, we have a lot of application. This is just one of that. So one of the application, what we did is that we use it for the tendon. So this is idea. Again, I think that this is the science is there now. We just find the application. But application, I knew we have a demand there. So I asked myself the question. I said, if I have a tendon, if I squeeze it, because the tendon will be more packed. If the tissue being more packed, their stiffness may be increased. So indeed, we did a study first. We compressed the tendon. We found out the stiffness increase. Aha, I say that's good sign. So that's what I say. Why don't we using the tendon, the flexor tendon, as our surrogate? So I can measure the pressure by using shear wave elastogram. When the tendon is outside the joint, I get a value. Then I extend my finger. The tendon will move into the tunnel, will be squeezed within that high pressure. Then I measure the stiffness again. Stiffness increase. In the laboratory, we calibrate the stiffness versus the compression, the pressure. So inversely, based on change of stiffness, I can estimate the pressure. So indeed, that is true. That's how they can be in the carpal tunnel patient. You can see, in fact, their ratio increase compared with the healthy individuals. So this is gradually, then they can adopt this for the carpal tunnel measurement without poking through the needle. So this is my last example. Again, I just want to give the young people idea here. Of course, study in depth is very important, but constantly you try to think about, in case I finish this technique, so what? So of course you can get a paper in Nature, Nature Communication. But on the other hand, you have to think about, especially for us working in the hospital, we will always think, if this is a technique, how can you benefit the patient with this technique? So when we apply for grant, I always ask my fellows, when you finish this, so what? If he says, oh, this is a nice, innovative science, but I say, if you have not much application, probably I won't encourage you to submit or spend a couple more days, think about what can you help the patient with your discovery or with your basic research. So this is one of the attitude for the applied aspect. So I think this is the last one. Again, we're talking about mechanical biology, so we don't have time to go into that. But again, as usual, I have to thank all these other people. I don't have too many students because we are not really, we only have a small size of a BME department, maybe about 20 students per year, and with probably 40 faculties, probably every other year you just get one. Then I have a lot of fellows. Many of them are either engineers, but most of them are MDs from all over the world. So I'm very proud. I spent 40 years at Mayo. I trained probably close to 300 fellows. I'm very happy they are doing very well, including many of them. They are in Taiwan. They are chief of many of the hospitals right now. So this is the slides I want to also show you. Dr. Paul Brand is one of the hand surgeons I respect very much. He himself is not only a good hand surgeon. He was educated, grew up in England, but he and his wife is also a hand surgeon, immediately after training went to India to help out the patient with leprosy. So he is the one he discovered why does the leprosy patient have a lot of laceration on their feet, so on and so forth, because they lost their nerve sensation. So that's what they bump into stuff they cannot feel, and eventually infection, and they have to cut that. Then eventually he come to America, and he was in charge of the Hansen Medical Center, namely for leprosy treatment. And he is also very devoted to Christians. He spent good time with the patient without complaint in India and in America. And he himself published a book with Bill Yancey. It's called Fearfully and Wonderfully Made. Basically, that is the word come out from the Bible called Psalm 139, 13 to 14. Namely, I try to say the hand is a very capable hand. I can guarantee you it's not evolved from the monkey. It's created. So that is a hand. We can talk a lot of story about hand. I just briefly show you. But so the final slides, of course, I have to just like a professor, the academician side. He acknowledged his wife first. He was worried about he may not have time to acknowledge. But finally, I have to acknowledge my wife as well. This is my wife. Unfortunately, she went to be with our Lord in 2009 due to pancreatic cancer. So she went to be with the Lord. But she was a Christian when she was a student at National Taiwan University. When we get married, I was not Christians. But throughout the year, finally she convinced me. She said, don't take things for granted. You are nothing better than other people. God has been very faithful of you. So I keep that in mind very much. So another thing he always remind me is that, especially what we work on the earth. So this is a very accomplished group here. You have the fortune to work at Academic and Sinica. So you have a lot of accomplishment. These are all accomplishment, include many of academicians, professors, and so forth. But without knowing Jesus, so these are all still zero there. Until that moment, this one makes the difference. All the zero will be very meaningful. So I still remember she reminded me this when I was young. I kept that in mind. Of course, I appreciate more and more of this advice. So I like to share that with you as well. Again, thank you very much. I used too much of your time, but I hope you get some idea.